morning, church. Isn't God great? All right, so this morning, mine is the privilege to present. Of course, we know that every month there's a medical condition or different medical conditions that are celebrated in each month. So January is termed as Cervical Cancer Awareness Month. And so I was given the privilege to present that topic this morning. Please sit back, relax, and open your minds to learn a lot more this morning because it's quite informative. I tried my best to put it in a way where we will all understand and we'll be able to, my hope is that after the presentation today, you will be able to go out and teach somebody else. Amen? All right, so cervical cancer. Next slide for me, please. What is cervical cancer? Cervical cancer is the growth of abnormal cells at the cervix. Sounds foreign. We cannot talk about cervical cancer unless we know what is the cervix. What is so special about the cervix? All right? And the cervix is the lower part of the uterus that connects to the vagina. Coming back to you now, sounds familiar? Yes. The cervix contains glands that makes and releases mucus. The cervix is simply what we call the neck of the womb. All right, so we have the uterus up top, the cervix in between, and the vagina is below. Have a little picture in your mind as we go along. We're talking about the little pink cervix. So it's a little dimple, and it will be different in every woman. Every woman, your cervix will look a little bit different. All right? The cervix secretes mucus, which closes entry to the uterus, thus preventing infection going up to the baby. So, of course, when you hear a woman is going into labor and you said that her mucus plug has fallen out, that is pretty much what was placed there by the cervix to prevent any infection from going up to that baby that is growing inside. It opens up during labor, thus allowing baby to pass from the uterus into the vagina. Yes? It allows for the passage of menses from uterus to vagina during menstruation. It secretes mucus that makes fertilization easier. So the cervix, trust me, it has a brain of its own, right? The cervix is very well made, and who else? The Lord did that. During labor, the cervix dilates, right? Which means that it stretches, and it effaces to allow, which means it thins out, right? To allow for the delivery of the baby. That sounds miraculous, don't it? Yes, man. A physician can know how many centimeters you are by checking the cervix. So when you go to the labor room and the midwife or the doctor says to you, you're 3 centimeters, you're 10 centimeters, it is your cervix that they're assessing with their fingers. Yes? It also prevents objects that are placed in the vagina, such as medication. From time to time, persons will need medication, right? And the cervix is right there. So when you put it in the vagina, it doesn't shoot up to the uterus, all right? It is like a protecting organ right there. Now, that we have learned a lot about the cervix, we can continue with cervical cancer, right? Now, and you can see right away that this organ is very important, all right? There are over 150 strains of the human papiloma virus. And what is human papilloma virus? This is a virus that is a causative factor. While there are other causes that causes cervical cancer, the human papilloma virus, which is sexually transmitted, is a very key note in cervical cancer development. And we're saying here that it has over 150 strains. But guess what? Not all of them are problematic to the cervix, right? So there are about 14 of them that are responsible for the cervical cancer, but there are 2 troublemakers in the lot, right? There are 2 troublemakers. They just give trouble some man, right? The strain number 16 and the strain number 18, right? And they are being the most responsible for what we call cervical cancer. Now, we're going to move on to the signs and the symptoms of cervical cancer. And please, if you're having any of these symptoms, don't start crying and asking for deliverance, because there are other conditions that can mimic these symptoms and signs. All right? So we say once you're having certain signs and symptoms, do not diagnose yourself. All right? Do not run to Dr. Google. Please go and get yourself. What's the word? And when in doubt, check it out. Amen. So we have vaginal bleeding after intercourse, between your period or even after menopause. So you have persons who they'll just bleed at intervals. It doesn't need anything. It just happens. You have gone through menopause and you find yourself bleeding. Red flag. When your period is lasting for longer and heavier than usual. So you normally have a 5 to 7 day period. That's the normal for most women. And you look, all of a sudden you're having 10-day period, 14-day periods. Red flag. Watery or blood-tinged vaginal discharge that may even present with an odor. Red flag. Pelvic pain. So apart from your premenstrual symptoms or your menstrual symptoms, you're finding that you're having severe pelvic pain, right? Even things that weren't affecting you before, it starts affecting you now. Be thou be warned, get assessed. What are some of the risk factors? Some of these things that will contribute to cervical cancer. The number of sexual partners that you have. It increases your risk of having the human papilloma virus. And just a note, for the human papilloma virus, it presents with warts. So, in case you're wondering what it looks like, this virus presents with warts, and they have not yet found a cure for it. So once you are infected, you stay infected. What you will be doing is treating the symptoms as they present, all right, to make you as comfortable as possible. And that is one of the reasons why it is so hard to deal with, all right? Commencing sexual activities at an earlier age speaks for itself. There are so many other things that will present. Ovarian cancer, we name it, just by beginning early sexual activities. Smoking increases the risk of human papilloma virus, and this tends to last longer, and it doesn't go away. So in some cases, the HPV, which is the human papilloma virus, after a while it will, tend to subside and go down on its lowest. But if you're smoking, this prevents the virus from leaving or trying to even normalize itself or go down to the lowest that it can be. All right, so for those who know somebody who smokes, especially the ladies, be thou warned. And remember that secondhand smoking is probably more dangerous than the person who is smoking. All right, so if they're smoking and you're constantly in the environment, you will be affected. Yes? Other sexually transmitted infections. So if you have other infections, herpes, chlamydia, gonorrhea, all of them, that increases your chances, all right? And a weakened immune system, it already speaks for itself. Once your immune system is low, it allows for anything to pass, yes? What are some of the types of cervical cancer? There are 3 types, but I will zoom in on 2 types today. For the squamous cell carcinoma, once you hear carcinoma, you hear cancer. This occurs to the outer part of the cervix. So when the when the midwife or the physician goes in with that speculum in the vagina, that is what we're looking at. That's what we call the squamous cell carcinoma, right? And this accounts for about 70% of the diagnosis. We also have the adenocarcinoma, and this type begins upper into the cervix. So you're not able to see this. It's in the inner part. And so sometimes you'll find that when we go down to screening, the pap smear might not detect this one. Further assessment will detect that one, all right, because it's hidden, it's upper. Now, when we're screening for cervical cancer, what can we do? The pap smear. Everybody hear about pap smear? All right. A pap smear is a test that sees a sample being taken from the cervix and sent to the lab for testing. Now, what takes place in a pap smear? When you go in, they will place you on the bed. They will do your assessment. A speculum, whether metal or plastic, will be placed inside the vagina, opened up so we can view the cervix. And a little feathered brush. We're not cutting off anything. We're not scraping off anything. We are taking a sample of the cervix. We put it on a slide. We spray it with a fixative, and it is sent to the lab. All right? So I went through that process so that the ladies can appease their mind. A lot of us have not been doing our pap smears because we are afraid. Yes? It sounded easy a while ago, don't it? That's not what they told you, don't it? Yes. That's all we're doing. All right? So please get your pap smears done. We will also do a human papilloma virus test. And if this comes back negative, happy days. Happy days, yes? Because as we said, the HPV is the troublemaker. Now, how do we diagnose cervical cancer? A biopsy based on what is said. So when we do the pap smear, the results are returned, and then we will know where to proceed. So it can come back as being normal, right? It can come back as being squamous cells present, as we said before. In cases like those, we'll send you refer off to the gynecologist, and then they will decide. Now, when it reaches to the gynecologist and they're going to take action because something is there now, they do a biopsy. And this is where now they will remove a small piece of the cervix or the body parts, because a biopsy is done anywhere in the body, and it is sent for testing. X-rays, CT scans, MRIs, and many other tests are done. All right? Now, for the staging, because we always hear stage 1 this, stage 2 this, stage 3. 1 to 4, with the lower stage, which is stage 1, being confined to the cervix, and the greater, which is stage 4, that would have spread from the cervix to other body parts and areas. And that word, we call that it has metastasized, right? So it has spread to other areas. What are the treatment for cervical cancer? Treatment for cervical cancer depends on the stage and if you have any other medical conditions. Surgery, cancer is still confined to the cervix, and that is often the way that the doctors go. If it is still in the cervix, you know you have a greater chance, can operate and do what you need to do, right? They can decide to remove just the area where the cancer is located. Sometimes when you look at it, you can actually see it. It's right there. They will remove that. They can remove the cervix. They can decide it's so bad that, listen, the cervix is better off out than in, right? Or they can decide to remove the entire uterus and the cervix, and that's what we call a hysterectomy. Radiation, and this is using powerful energy beams to kill the cancer cells. We have chemotherapy, the use of strong medication to kill the cancer cells. You have immunotherapy, palliative care, and there are so many others. So based on what presents before the physician, they will determine which one, 2, or 3 of these treatments they will use. How do you prevent cervical cancer? Get your human papilloma virus vaccines. And you would have heard them distributing it. The public health nurses have been going around distributing it in the schools to the young girls, and now it is being extended to the boys, right? So once they get to high school age, you will find that the nurses are coming in and doing their vaccination. Parents, I encourage you, allow your children to get their human papilloma virus vaccine. You have already gone, which means that you're over the age of getting it. Be fair. We know what is happening around us. Allow your children to get their vaccine that they need. You don't know what is going to happen to them. Let it not be that when it happens, that's when you're going to say, if I knew then what I know now. All right? And you can request more information about the vaccine if you're uncertain. We encourage you to start doing your routine papsmears beginning at age 21. Hello? Anybody way over 21 and have not done a pap smear? Find your gynecologist. Thank you. You are to do your pap smear every year. And after 3 normal readings, we encourage you to do it. Some will say 2 years, some will say 3 years. Based on what we see, we will encourage you 6 months or yearly. All right? Practice safe sex. We can't preach this anymore. Do not smoke, or do not put yourself around persons who smoke. All right? And that concludes my presentation today on cervical cancer. I will go further to say that for persons who are wondering, cervical cancer is preventable. It is treatable, yes, but early detection is key. And that's why we encourage you to do your pap smears, get your HPV test done. As a matter of fact, you should make all your assessments an anniversary. So some persons, for their birthday or their birth month, they will go and do a full head-to-toe assessment, do a full blood, complete blood work, and everything, and so they're happy for the rest of the year. All right? Thank you.